Discuss how the neural and endocrine mechanisms maintain homeostasis within the blood vessels. The body uses sophisticated neural and endocrine mechanisms to maintain homeostasis within blood vessels, primarily by regulating blood pressure and flow to ensure adequate tissue perfusion for all organs. Neural control is managed by the autonomic nervous system, which automatically adjusts vessel diameter and heart activity. The sympathetic nervous system generally causes vasoconstriction, which is narrowing blood vessels and raising blood pressure, such as during stress or the fight or flight response. The parasympathetic nervous system can cause vasodilation in some vascular beds and slows the heart rate, helping lower blood pressure and conserving energy. Key centers in the brainstem, particularly the medulla oblongata, constantly monitor signals from specialized sensory receptors. Baroreceptors, located in the walls of the carotid arteries and the aortic arch, detect changes in blood pressure. For example, if blood pressure suddenly drops, such as when standing up quickly, baroreceptors sense the reduced stretch of the vessel wall and send fewer action potentials to the medulla. The brain responds by increasing sympathetic activity and reducing parasympathetic output, which causes vasoconstriction and a faster heart rate, rapidly restoring blood pressure. Conversely, when baroreceptors detect excessive vessel stretch from high blood pressure, they trigger increased parasympathetic and decreased sympathetic activity, leading to vasodilation and a slower heart rate to lower pressure. Chemoreceptors, found in the carotid bodies, aortic bodies, and within the medulla itself, detect changes in blood oxygen, carbon dioxide, and pH. For example, during hypoxia or low oxygen or hypercapnia, elevated carbon dioxide, chemoreceptors increase their firing rate. This stimulates medullary centers to boost respiratory rate and depth and to raise sympathetic output to the heart and vessels, improving oxygen delivery and helping remove excess carbon dioxide. Endocrine mechanisms involve hormones released into the bloodstream that influence blood vessel tone, blood volume, and heart function. Important examples include epinephrine and, to a lesser extent, norepinephrine, released from the adrenal medulla, which increase heart rate and promote vasoconstriction during stress or exercise. Most norepinephrine in the body, however, is released directly from sympathetic nerve endings rather than from the adrenal glands. Antidiuretic hormone, or ADH, released from the pituitary gland, prompts the kidneys to retain water, increasing blood volume and blood pressure, especially in response to dehydration. Aldosterone from the adrenal cortex signals the kidneys to retain sodium and water, boosting blood volume and pressure as part of the renin-angiotensin-aldosterone system, or RAS. Atrial natriuretic peptide, or ANP, released from the heart in response to high blood volume, causes vasodilation and prompts the kidneys to excrete sodium and water, reducing blood pressure. These interconnected neural and endocrine mechanisms allow the cardiovascular system to adapt quickly and effectively to changes in body position, activity, or stress, keeping blood pressure and flow stable. Disruptions in these control systems can have serious clinical consequences. For example, faulty baroreceptor or hormonal signaling can contribute to uncontrolled hypertension, while certain drugs that target these pathways, like beta blockers or ACE inhibitors, are commonly used to manage blood pressure. Understanding these mechanisms is essential for diagnosing and treating cardiovascular diseases and for safe medication management in patient care.